Of course, we have been really serious about this, because let me first and foremost say that it is very painful for all the patients that have been hurt by this. I've also apologized for that, but I've also said what we need to do is actually see, first of all, how can we remediate these patients so that they get the new products, so they can get the sleep devices, which we actually by now did. 99% of devices have been replaced. So actually the patients that had a device have now a device they can use in their sleep. Secondly, we have also been focusing on kind of how can we make sure that there's no appreciable harm. So we did testing to also prove that no appreciable harm was done to patients. So that also came out, and that's very important for the patient. So there's a lot of patient focus on that, and we need to take the learnings from it. That's also when you heard me say that the first priority for me, company-wide, is patient safety and quality, because we want to guarantee that all the time that anybody uses a Philips product, they can be reassured that actually this is of the highest quality.
I think you two have covered that issue very well, so I'm going to move on if I may. Look, to say that I'm excited about healthcare and nutrition, personally, and the opportunities is an understatement. And I know that it's something that first Franz and now you have worked very, very hard on, this transformation of your company. We got in trouble with Philips a few years ago because we say consumer electronics company, and we get your communications people say, we are not a consumer electronics company, we're a healthcare tech company. Anyway, so we've learned our lesson. That was probably about 8-9 years ago, to be fair. But in terms of the opportunities, and I will pick up a little bit on Karen's point that actually your shares have rallied. They've rallied brilliantly from the low, 43% as of this moment of speaking from their lows. But she's right. We haven't realised the exciting potential of this area yet as well. So what are the big challenges realising the goals and those exciting opportunities?
Yeah, so I think building on what you say, healthcare, of course, is a huge domain in the world, and there's a significant demand for more healthcare services, especially as I mentioned that the amount of patient population is growing everywhere, and especially after COVID, we have seen many caregivers walking away from their serious and hard tasks that they have to do. So we need to come in with technology to see how we can help actually the healthcare segment to treat all these patients. That start with, for example, doing early monitoring. If you look at, for example, cardiac disease, it's still the #1 death cause of the world. 80 million people a year die of cardiac disease. We have one service in which we actually do cardiac remote monitoring in people's homes to really pick up heart rhythm disorders or early signs that could lead to stroke or to cardiac arrests, because 4 out of the 5 cardiac deaths are still cardiac arrests or strokes. So we try to catch it early. Then actually we are doing diagnosis, and in the diagnosis we are using more and more AI to actually speed up the scanning, because we're getting a lot of requests from the healthcare hospitals to say how can we do it faster and with a better experience for the patients. So we bring in our design experience to actually make it more comfortable. It's never pleasant, but we try to speed it up, and then also we try to give them a better minimally invasive care pathway, because if you need to have a heart surgery, in the old days you need to have an open heart surgery, it's weeks that you're out of the running. Currently, with our latest technology in minimally invasive therapy, where you can put a stand in an afternoon, you can leave the hospital the next day. So that's areas where we focus on to really across the journey of a patient, picking up early, making the diagnosis quick and precise, and then a treatment that actually is effective.